Hi, my name is Hannah Floyd and I'm a speech-language pathologist here at San Joaquin Valley Rehabilitation Hospital. It's May, and that means it's Better Speech and Hearing Month. This is a month that we as clinical professionals like to use to spread awareness and education about communication disorders and our role in treating them. Speech-language pathologists have a pretty broad scope of practice, but the condition I'd like to talk to you about today is called aphasia. About 2 million Americans live with aphasia, and about 180,000 new cases are diagnosed in the country each year, but most people have never heard of aphasia. So what is it? Well, it's a neurogenic communication disorder caused by damage to the brain, typically the left hemisphere. Aphasia is most often caused by stroke, but it can also be caused by brain tumor, traumatic brain injury, and diseases like Alzheimer's. There are a few different types of aphasia, like Broca's, Wernicke's, global aphasia, anomic aphasia, among others. The things that all the types kind of have in common is that they affect these 4 components: spoken language expression, spoken language comprehension, written expression, and reading comprehension. It's also important to note that aphasia is a spectrum. It ranges from very mild to very, very severe. One person's aphasia might look like very mild word-finding difficulties. Another person's aphasia might be very severely impacted receptive and communication expression. Our role as speech pathologists is treating aphasia in individuals, but it's also counseling for the individuals and their communication partners. So you may be asking yourself at this point, why should you care about aphasia? Well, at some point in your life, you'll probably meet someone who has aphasia, or maybe you have already and you just didn't know about it. Either way, increasing community awareness about aphasia increases our understanding and acceptance of people who have this condition. When we know better, we do better, and maybe by learning about aphasia, you can be a more patient and compassionate communication partner when you meet someone who needs a little bit of extra time or support when they're communicating. So, I'd like to give you some tips so that you can be a better communication partner when you meet someone with aphasia. Number 1, take it slow. Give the person extra time to communicate or understand what you're saying as needed. Don't talk for the person with aphasia. Number 2, reduce environmental distractions. That can be excess noise, it can be reducing multiple conversations at a dinner table to just one conversation happening at a time. And number 3, keep it clear and simple when communicating with a person with aphasia, but don't talk to them like they're a child. It's also important to remember that aphasia is not a loss of intellect. Aphasia just affects the language, it doesn't affect the ideas and thoughts that the person has. I hope this video has made you more aphasia aware, and I hope you'll consider sharing it with your community to increase understanding and acceptance.